City of Calgary. I'm AFLCA instructor. We're here to help you stay active and fit while at home. This video will give you ideas you might want to choose to incorporate into your fitness routine. We know that everybody is different and that there is no one-size-fits-all exercise program. So we encourage you to listen to your body and honor your ability and how you feel today. If at any time you experience pain or strain, please refrain from doing these exercises. Today we're going to be focusing on the postnatal population. Our recommendation is that you start to exercise progressively after having a baby. It is important for your recovery that you make rest a priority. If you had a baby recently between 0 to 6 weeks, we will ask you to focus on connection, breath, walking, and rest. After 6 weeks, we absolutely encourage you to join us into the exercise program that we prepare for you today. So to start with, we're just going to need a chair, and we're going to start talking about breath connection. So what is breath connection? It's truly breathing 360. What does it mean to breathe 360 and what is it all involved in that? So we're going to try it out. So I'm just going to ask you to put your feet flat on the ground, hands on your thighs, and we're going to take a deep inhale as the pelvic floor lowers. And exhale, pelvic floor comes up, ribs come down, and inhale, relax, exhale, bring it all together, inhale, and exhale. Inhale, and exhale. So I'm going to ask you to do this exercise on a regular basis. It is important to your recovery after having a baby, as your pelvic floor has had trauma, whether you had a C-section or a vaginal birth. So one thing I'm going to say on this exercise, and this will include, everything that you do throughout your day, especially now that you have a newborn, you are going to be sitting quite a bit. So what I want you to focus on, it's not sitting on your tailbone and having that tack position in your pelvis and either creating more of a curvature in your lower back. But what I want to see is a neutral spine, neutral. Whatever that means for you, we're not all the same. We have different curvature in our spines, but also to have a neutral pelvis. Neutral pelvis meaning that if you put like your bones here, if you put both your hands in front of your hips, and you shine them forward, then that light is going to shine forward and not down or up. So before we move on to anything else, I wanted to talk to you about diastasis recti. It is very normal after having a baby that we have diastasis recti. What is diastasis recti? The two halves meet here, and there's that putty-like tissue that brings it all together. When we're pregnant and our belly grows, that tissue stretches, and it's very common to find the abdominals separate. It is important that we rehabilitate that because if we don't, then we'll start having lots of issues with our lower back, and our core doesn't fire up the way that it should, and then it creates a lot of injury. All right, so we're going to go down to the floor, and please take a look at how I'm coming down to the floor. So the idea on this is not that I'm going to just plop myself on the floor, but I'm gently coming down, putting my hips down, and then sliding, and then rolling onto my back, okay? So the first thing that we want to do, we're going to put the fingers not this way, but this way, and facing down towards the feet. I still have my feet planted, and all I want to do is go up and down from the sternum all the way down to the pubic bone, and just feel it. Feel if there's resistance in that linea alba, or you feel something under your fingers, or you don't, and maybe it just goes in. It doesn't offer any resistance. Okay. So from here, what we're going to do is you're going to take a big belly breath. Exhale. Bring the pelvic floor and the belly button up, lower your ribs, and just get the head off the ground. And what I want you to feel again is if there's any gap, if those two sides of the abdominal walls are coming together, and then relax again. We don't need to hold this for very long. Just take a mental picture of what that looks like. We're going to inhale again, big belly breath. Exhale, pelvic floor up, ribs closed, top of the belly button if there is a separation. And if there is, just make a mental note of how many fingers. Now, to get up, I'm going to roll onto my side, coming onto my hips, and then back onto my knees. We're trying to help your core by not putting more force into it and creating more of a separation. If you do have a separation, it's okay, it's normal, we all go through it. And the idea is to have a rehabilitation program that will actually address the fact that you have an abdominal separation. Again, I want to remind you that if you are fresh out of having a baby between 0 to 6 weeks, we ask you that you do all of your breath connection, you take walks, and you prioritize your rest. It is very, very important that you do that. If you're 6 weeks over and your midwife or your doctor, your healthcare provider give you the green light to exercise, then so please do join us doing all of these exercises. So what we're going to do is just start by gently moving the legs and just kind of a march, but just lifting the feet up, nice and gentle. Make sure that your hips are nice and square and I'm not sinking into my hips every time that I move my knees up. Now we're going to bring it out a little bit. If this brings any discomfort into your pubic bone, then just stay with a regular march. But otherwise, we're just going to be side to side. And then we're going to change it to do a curl back. Excellent. And we're going to go opposite sit bones with the legs. Nice and tall, keep breathing. Remember the connection breath. It is very important that we keep that. All right, we're going to move it forward. Again, kick it forward. Good. You should start feeling a little warmer by now. And then we're going to change it and we're going to kick it out. Kind of funky. But the idea with this is to bring a little bit mobility into that hip. And regular march. Excellent. So you should be feeling a little warmer now. Again, remember, this is not meant to be your cardio. This is just meant to help you sort of warm up the body. We're just going to go through articulation of the spine. So you're just going to come down and then right back up. And down. And right back up. And you don't have to go all the way through. And so when you come up, I want you to make sure that there's a point where you're shining your collarbones up, but then you're not crashing your cervical spine here. Yes, I want to be looking at the ceiling, but not crashing my cervical spine. Then, if you're fine going in all fours, then I would encourage you to come with me. And so we're going to do a couple of cat-cows. Same idea applies here. Make sure that you're not collapsing your cervical spine back. So there's going to be none of this. Yes, but there's going to be a sense of moving more from the collarbones and looking right in front of you. So you're going to be doing about 10 of these ones. All right. Now we're going to move into the sit and shift. So we're just kneeling and hands to the side, and we're going to move side to side. And in here, the idea is not to plop into the mat, but gently place your hips down. Don't worry if your hips don't touch the ground, it's fine. We all have different range of motions and mobility. My hips tend to be quite a bit of flexible, so it's okay if your hips don't touch the ground. So you're going to be doing about 10 of these ones. And remember, inhale and exhale. Never forget about that. If you need to take a break, then by all means pause and take a break. If you need water, then take a water break. All right, last one here. Excellent. Now we're going to move into our next exercise, which is the side plank. So for me, side plank looks a little bit different than the regular side plank. So you're going to find that your knees are going to line up with your wrist here. I am not collapsing into my shoulder, but I'm keeping that shoulder girdle nice and stable. And also the side of my body is not collapsing, but it's nice and lifted. So then your obliques are doing work, all right? And from here, what we're going to do is a hip hinge. So we're gonna push the hips forward, and then we're gonna place them gently back. And the hips forward, and then place them back. So your glutes are doing most of the work here. And then press forward. And then back, press forward, and back. So that's 5 repetitions on each side. We're going to do the other side. Again, remember your knees are going to line up with your hand in front. I'm not going to collapse in my shoulders. It's nice that the shoulder girdle is nice and tight. And same with your side body. Now I'm going to push through my hips and bring them forward and gently place them down. So that's 2. Remember to breathe. And your last one here. Excellent. To come up, remember, we're just going to go into our knees and then push from the glutes and the thighs, and then we're going to come up. So I'm going to sideways so you can actually see me. It's called a short stop squat. So I want you to place your hands on your thighs, and then from there try to sit on the chair behind you until your hands touch your knees, and then coming right back up. Yes, and then sit on the chair behind you, and then right back up. And coming right back up is going to be all about your glute pushing forward, okay? And then right back up. So we're just trying to work that back chain, because with pregnancy is one of the first things that kind of go dormant in your body. And then again, and pushing right back up. So you're going to do about 10 of this ones, okay? Now our last exercise is going to be a modification of a bird dog. So you're just going to need a little bit of a towel, stable wall or surface, and you're going to find your standing leg, so you're not going to collapse in it, but you're going to be using your glute, and then the opposite leg is going to slide on the floor, and then right come back up. Slide on the floor, and then right back up. Slide on the floor, and then right back up. So the idea on this is not your lower back doing the work, but your glute finding that movement, yes? The bird dog is all about the movement on the hip, not on your lower back, okay? We're gonna switch to the other side. So again, find your standing leg, making sure that you're not like sinking into that hip, but that you're using that glute. And then from the glute, you're going to slide that foot on the ground. If you feel that you're stable, you can add a slide of the opposite hand to opposite leg. Now be careful on this, that when you bring the arm up, that the ribs don't go, okay? So making sure that the core stays very stable. All right, so you're gonna do about 5 of those on each side. And that's going to be your workout for today. That's the mobility and core workout for the postnatal population. You can do these exercises only one time, or you can repeat it 2 times or 3 times. You can just do them throughout the day. Have fun and stay safe. So before I let you go, I just wanted to check with you regarding the intensity of your exercise. And one of the questions that I always pose to my postnatal population is, am I ready for more? How about the intensity at which I was exercising before having baby? And for me, the answer to that question, and only you can answer it, is by being truthful and answering the 3 P's. So peeing, prolapse, and pain. If I increase the intensity of my exercise, am I having incontinence? If I increase the intensity of my exercise, is there a feeling of prolapse of organs? Or if I increase the intensity of exercise, do I have pain? Listen to all of that, because your body is telling you if any of those ones or a combination of is happening. The answer to that question, am I ready for more, is no. The idea on exercising after pregnancy is that you find a program that allows for rehabilitation and recovery. Remember that while pregnant, you have had a huge change in your hormones. Lots of organs shifted and move around, your tissue softened, and everything expanded. And so now that you have baby, you have to look after yourself, and rest is going to be the priority for you for the next few weeks. So use the 3 P's as you go throughout the exercise routine, and be truthful to yourself and honor your body the way that it's feeling today. Have fun, and I will see you next week.